Lantern's a digital mental health company, and we use cognitive behavioral therapy, which is the gold standard for conditions like stress, anxiety, depression, and we deliver that program over a smartphone with a great user experience and a really great user interface, and then we couple that with a human coach so that we have software plus the human element to really help people reduce their symptoms and ultimately become healthier, happier, and more productive people.
Wish we could turn back time to the good old days when the mama sang us to sleep, but now we're stressed out. Wish we could turn back time to the good old days when the mama sang.
All right, last demo of the day. Oh man, come on, that's at least worth a little ovation, huh? Thank you. Thank you, thank you, thank you. So, by virtue of being last, Eric's actually given me a little latitude for something different. I can't believe actually you guys have been sitting here for like 4 hours, and so I'm putting myself in your own seat. This is actually maybe even more comfortable than most of you guys have. So, I'm guessing that most of you guys are already kind of checked out, and I don't say that other than, you got a lot going on, right? A lot going on in healthcare. You probably want to get home. You might be getting a little hangry. You might be thinking about all those emails, and you're probably thinking about all the work that you have, you left behind, and you're going to need to, get at tomorrow. So let's do something very different. I want to ask you guys to join me. Actually, just take a minute, and let's take an opportunity to relax. Let's take an opportunity to refocus. So I'm not exactly Deepak Chopra, but I'm going to ask you guys real quick, let's sit in your seats, all right? Do what your mom said, improve your posture. Get your feet set, get your hands comfortable, all right? I want you all to join me in just a collective breath, right? So let's just breathe in. And let's take a long exhale. Probably feel better already, right? Just one breath. Let's do one more thing. You're feeling comfortable now, and you're all among friends. Just close your eyes for a second. And I want you to be present. I want you to be here. And I want you to think for just a second. You've been here for 4 hours. And you are, and I'm going to channel Eric right now, you are in the innovation hub of the most amazing and largest medical center in the entire world. And in that, you've just listened to 20 of the best digital health companies that are all talking about transforming healthcare, and you are actually in the center of that. So feel free to open your eyes for a little bit, but I want you to feel good about yourself. I want you to feel good about your role in helping change healthcare, and I want you to feel really good that you are less than 4 minutes away from the last demo of the day. All right, guys. And I'm less than 4 minutes away from Eric being not so happy with me. All right, so here's what I want to talk about today. I want to seriously talk about mental health conditions. And mental health conditions are extraordinarily prevalent, and actually about 20% of all Americans experience a mental health condition in any given year. That's about 50 million people, and so if we look in this audience today, it's very likely that every one of you have a friend or a family member or a coworker who's been impacted by mental health. But the real tragedy of it is less than a third of those people actually receive the care that they need. And the reasons behind that are many, but they really boil down to stigma, issues around access, and issues around cost. And I'll just give you one quick data point. There's more than 250 counties in Texas. About 185 of them actually don't have a psychiatrist anywhere in the county. So the ability to access, and even if you could pay for it, it's really difficult to get the help you need. That's the problem that Lantern's really trying to solve. The human impact of all of that is massive, but the financial impact is huge as well. People who have even a mild to a moderate mental health condition have significantly higher healthcare costs. And those healthcare costs come in the form of prescriptions and doctor visits and ER visits and hospital stays and ambulance rides, and it really adds up to the degree that it's 2 to 6 times more expensive in terms of healthcare cost and utilization for someone with mild to moderate versus the average. And across the entire health system in the US, that's about $250 billion in additional cost on an annual basis. So in today's value-based environment, if you are a health system, if you're a plan, if you're an employer, and you are responsible for the clinical and financial lives of your patients or employees, your population, that's something that you're bearing today, and that's something that going forward you have to figure out how to solve and deliver better, more cost-effective, higher quality mental health. And so that's really what Lantern does. At the core of our program, we've got cognitive behavioral therapy, which is considered to be the gold standard for anxiety and depression. We deliver it in a program on a mobile phone, so it's available anytime and anywhere. But beyond the software, we couple it with a professional coach, a live, one-to-one, dedicated person who's committed to helping patients move through the really difficult change associated with improving your behavioral health. So, we began our journey more than 5 years ago. We licensed research from Stanford. We immediately went into multi-site clinical trials around that, and we now have evidence that we deliver higher efficacy, higher engagement at a fraction of the cost of the outcomes associated with anxiety and depression, and compared to face-to-face. We've since then gone and begun to commercialize with a range of healthcare systems, including Stanford, the University of Pittsburgh Medical Center, SEL Health in Denver, University of Michigan, where we're implementing in primary care and chronic care populations. And we're also at leading employers who are also today at risk for their employees at places like Facebook and Intuit. So just a quick little bit about our user experience, and really what makes us different is some of the approaches in the past have really been about how could I essentially translate a book or a 50-minute session to a phone. We don't do that. What we've really done is we've tried to break the therapy down into bite-sized chunks. We ask you how much time you have to devote to it, and then we deliver you something in 1, 3, or 5 minutes. Whether you're in bed or at lunch or commuting, you can get the care you need anytime, anywhere. But beyond being just an app, we're actually a platform. And one of the biggest innovations that we bring is the ability to capture data on all of these interactions and to know who's using the program, how much they're using it, what parts of it they're using, and ultimately are they getting outcomes. And so when you think about mental health today, it's a bit of a black box. You don't know any of those things. And with our platform, you know all of those things, and we can bring that data back as appropriate to the physician so they can help manage your care on an individual basis or on a population basis. So beyond efficacy data, we actually can help with engagement as well and measure all those things. The people who go to therapy tend to go one time. The people who use our program tend to go more than 15 times a month, essentially every other day. And they're not only getting the care they need, but they're getting the interaction with the coaches. And so what that really leads to is adherence. And we know that people are working with a program until they get an outcome. They're getting essentially the prescribed effective dose and getting better. So our ask here today is we really want to implement with you. If you're a hospital, a health system, a health plan, or an employer, we want to work with you. If you like what you've heard here today, we're in the back, and we can't wait to talk with you. I'm Steve Ditto. I'm the Chief Commercial Officer of Lantern, and together we can revolutionize the delivery and the efficacy of mental health care. Thank you, and we're done.